Good everyone, my name is Nishan Yunus Peningolo and I've got the topic measles. And for today, we're gonna talk all about the measles. Before all, we should know what is a measles. Measles is an airborne disease caused by a virus and it is very contagious. Symptoms may develop about 8 to 12 days after you're exposed. Symptoms can last 10 to 14 days and measles is also called aerobiola 10-day measles or red measles. It's not the same as German measles. And its causative agent is caused by an extremely contagious virus called, I hope I pronounced this right, morbillivirus or morbillivirus. In fact, if 10 people who weren't vaccinated were in a room with someone with measles, 9 of those people would get a measles. Measles is spread by contaminated droplets that are spread through the air when you cough, sneeze, and talk. As for this part, we will talk about the mode of transmission of a measles, how measles spread. It spreads when an infected person coughs or sneezes. It can spread to others through coughing and sneezing. If other people breathe the contaminated air or touch the infected surface, then touch their eyes, nose, or mouths, they can surely become infected. Animals do not get a or spread a measles. Measles is one of the most contagious disease. It is and is so contagious that if one person has it up to 90% of the people close to that person who are not immune will also become infected, as high as 90%. Infected people can spread measles to others from 4 days before through 4 days after the rash appears. Measles virus can live up to 2 hours in an airspace after an infected person leaves an area, as long as 2 hours. The virus can live for up to 2 hours in an airspace. This is an example of someone that has a measles. Its incubation period of measles from exposure to prodrome average 11 to 12 days. The time from exposure to rash onset averages 14 days with a range of 7 to 21 days. Its clinical manifestations, signs and symptoms. Measles symptoms appear 7 to 14 days after contact with the virus and typically include a high fever, a cough, a runny nose, and watery eyes. Measles rash appears 3 to 5 days after the first symptoms. Measles isn't just a little rash. It's not a little rash like this. Measles can be dangerous, especially for babies and young children. Measles typically begins with a high fever, a cough, a runny nose, and a red, watery eyes. Alright, so this is a sign and symptoms. This is can be seen in about 2 to 3 days after symptoms begin. This is called a acoplic spots. A tiny white spots, the acoplic spots, may appear inside the mouth 2 or 3 days after symptoms begin. And this is a little rash, a red rash 3 to 5 days after symptoms begin, a measles rash. This is what it looks like. 3 to 5 days after symptoms begin, a rash breaks out. It usually begins as flat red spots that appear on the face, at the hairline, and spread downward to the neck, trunk, arms, legs, and feet. Small raised bumps may also appear on top or of the flat red spots. The spots may become joined together as they spread from the head to the rest of the body. When the rash appears, a person's fever may spike to more than 104 Fahrenheit degree. This is someone with an measles. It has a red bumps in his faces and a rashes in his whole body. It is actually so sad that there's no specific treatment for a measles. You know, unlike bacterial infections, viral infections aren't sensitive to antibiotics. The virus and symptoms typically disappear in about 2 or 3 weeks. There are some interventions available for people who have been exposed to the virus, but getting vaccinated is the best way to protect against measles. The vaccine is given in 2 doses, with the first dose administered at age 12 through 15 months and the second dose administered as age 4 through 6 years. As for this one, here are some nursing responsibilities, a disease prevention and control, and also a nursing priorities in the care of the patients. For the disease prevention and control, you know, we cannot really cure a measles, the virus, but we can prevent it. Getting vaccinated is the best way to protect against measles. Therefore, the most effective way of preventing measles is with an active immunization provided with this vaccine, which is often incorporated with the rubella and our mumps vaccines in the MMR vaccine in countries where this illness represents a problem. As for the nursing priorities in the care of the patients with measles, measles causes extreme pruritus. I hope I pronounced this right, pruritus or pruritus. And nursing preventions include keeping the patient's nails short, encourage long pants and sleeves to prevent scratching, keeping skin moist with healthcare provider recommended lotions, and avoiding sunlight and heat. Airborne precautions, of course, because measles is an airborne disease. Airborne precautions prevent transmission of infectious agents that remain infectious over long distances when suspended in the air, like those rubella virus, the measles, bacillary virus, the chickenpox. And that is all about the measles that we talk about. I hope you guys learned something, and thank you all for listening. Thank you.